Economic recession triggered by the pandemic has shuttered many businesses across the Indian subcontinent.
Supply chains were disrupted. Financing was very difficult to get by. Cash flows stopped over, kind of very slow. Bank credit was difficult to come by. And demand collapsed for several products and services.
The lowest point in terms of business activities, it's mainly to do with market accessibility and then having access to the inputs.
Some businesses, however, have turned adversity into opportunity. How do they survive and thrive while others fail?
We shifted the entire company operations at that time from the clinics to the mobile application.
COVID is a crisis point. This COVID has opened the eyes to a paradigm mind shift.
It's consistently been ranked as the happiest country in all of Asia. Bhutan, the land of the Thunder Dragon, has resolutely focused on gross national happiness and social well-being, even in the face of the most pressing challenge of our time.
We have a very strong public health system. This has really saved Bhutan. There is no trade-off between lives and livelihood. Lives are far more important than livelihoods. Livelihoods can be supported, but lives cannot be. If you lose a life, then you just lose it.
While COVID-19 has hit every corner of the globe, its impact on small economies can be particularly devastating. The landlocked country announced its first coronavirus infection in March 2020 when a visiting American tourist tested positive. Its first COVID-related death came nearly 10 months later. With a population of around 750,000, Bhutan has managed to keep the spread under control by enforcing 2 lockdowns and banning tourism.
Bhutan is affected because we were dependent on tourism, so tourism affected, then hotel industries, then comes the construction, manufacturing, production, and the general trading. Because we are a trading country, predominantly we are import dependent. Therefore, when India was affected in the beginning, when it had series of lockdowns in 2020, first part, we were really affected.
Kinley Wangchuk's travel company, Breathe Bhutan, has been hit hard with the government sealing off the nation's international borders. The family-owned company, founded in 2015, prides itself with providing out-of-the-box experiences to its guests.
It's a small boutique travel agency. We've been doing pretty well in 2019, and we were expecting it to grow in 2020, but COVID-19 thing happened. And right after that, things just went downhill. Miyo viewers ki cancellation di chunga tangmena na foreign time ba, so details shimo bank details this. We lost all our business. That's it. When I say lose, it's just not losing 10 or 20%. There is no tourist anymore, and how long it's going to last. That is a big blow for us. Three months passed by, and it was only getting worse. I got really worried, sleepless nights. Jimmy Kachpedo, Nashosh. Had to think about not just my family, I had to think about the people who are working with me, my team, and they were all laid off. Most of the hotel staffs were also all laid off, and I did not want to lay off my team, because to build that team is the most difficult part of any business. Like they say, it's not the business that makes money, it's the people that make money.
With the tourism industry hit the hardest, Kinley had to come up with an idea to survive through the pandemic and to keep his team intact. During the lockdown, the Bhutan government announced the Urban Agriculture Program as part of the preparedness plan to ensure food security in the country. It was a scheme to provide 60 tour operators with small plots of land in capital Thimphu. Kinley grabbed the opportunity.
I applied for it and I got selected. Government was providing all kinds of assistance, starting from helping us plow the field, getting us water supply, giving us access to professionals like from the Ministry of Agriculture, not just local experts, even Japanese experts. So that was a very good learning curve for me.
As the son of a subsistence farmer, Kinley boldly pivoted to a different industry altogether. This has ensured that his staff are employed, even as the country is witnessing a rise in youth unemployment. More than 13,000 people lost their jobs in Bhutan after the pandemic struck.
The lowest point in current pandemic is, I would rather look from job loss and loss of income. These two are interdependent, I would rather say, because job loss, because many of the industries who were in self-employment, small and cottage industries, we were doing something on their own. They lost these because they lost the market, tourism, hotels and all these things. All of a sudden, because of lockdowns and all, import was not very convenient for their raw materials. And these are small timers, so they really lost their livelihood.
Sangay Nidap lost a big chunk of his business during COVID-19. He founded Bhutan Smart Shop in 2018 and aggregates farm produce from local growers to deliver to vendors and to consumers directly. With a nationwide lockdown, the footfall in his store was down to zero.
My firm and our team were very much worried how we were going to pay their rent, salaries and all. During the first day of country lockdown, I was in my home and I was very much worried that we won't be able to get opportunity to operate and deliver to the customer.
Now, if you want to look at entrepreneurs in the agriculture sector, I think this year really brought home what challenges were quite unique to Bhutan. So Bhutan is very reliant on import even of vegetables. So when we locked down first in August, vegetables were not readily available. Huge storage issues were there. Lots of vegetables rotted, so they had to dispose of vegetables because they weren't moving out as quickly as they were coming in.
35 kg. Why not?
Fortunately, Sangay received a call from a Ministry of Agricultural official, a member of Bhutan's COVID-19 task force. In a meeting that followed, Bhutan Smart Shop was one of the stores tasked with supplying vegetables to residents in the capital city. Sangay tweaked his business model and started Vegetable on Wheels, a delivery model taking local produce to people's doorsteps.
During the lockdown, Vegetable on Wheels was our sole income generation since we were allowed to move all around the places where the vegetable shops were not available to operate. Through Vegetable on Wheels, we have catered our service around 1,000 customers in a day. With the change in business model, where Bhutan Smart Shop could survive and expand further during the COVID-19 situation in the country.
While the pandemic has caused a huge strain in terms of job losses and income, the government's measures such as cash transfers and loan deferrals have allowed Kinley and Sangay to look beyond COVID-19 and into the future. Through deep pivots, these entrepreneurs have reimagined their business models to bring in not just more profit, but also more value to their customers.
Now, Breathe Bhutan, I assume that it's going to take another few months, but I'm pretty positive that travel will begin again. My travel business and the farming, I want to take it parallelly. Like for instance, I already have the unique selling point. When a guest comes to Bhutan, the experience that they get through me is they go to my village, they experience farming, go to the farm, pick whatever you want, and we make a food or a meal out of it. And I want to make this a part of the experience when they're visiting Bhutan.
His Majesty is quoted in the media as having said that we can repair the economy, but we can't repair or replace lives. That has been a driving factor for how Bhutan has dealt with the pandemic and how the people feel valued. So I think when we weigh the pros and cons, a lot of people feel that we are in a better place than most people in the world, and I think this is why the sharp edge of the pandemic hasn't cut us so much.
For a country that measures its worth in terms of collective well-being and happiness of its citizens, there are big lessons for Bhutan, both for the government and for these entrepreneurs.
We cannot just wait for the COVID to resolve by itself. We have to have now smart mechanisms to work with COVID. And for 2021 and further, our economy must focus on the power of IT, on digitization. Bhutan was a geographic, landlocked country. Now we should not be digitally locked. I would rather say our geographic lockedness should open to digitalization, and we have to focus on e-commerce and digitalizing our systems and our services.
$75 bundle. Yeah, cabbage.
Don't keep all your eggs in the same basket, first of all. Secondly, sustainability, especially for our country, is something that we really need to consider. Self-sufficiency, be it vegetables or be it food or even manpower or human resource. Thirdly, technology is the way forward.
Pivoting to survive is, however, not unique to businesses in Bhutan. Some 2,000 kilometers away, in the world's 5th most populous country, Pakistan, a telemedicine platform led by 2 women transforms to better serve the nation in the face of the pandemic.
We made that pivot very early. We took a huge risk, but we also made sure that we are standing at the back of that risk, performing 100%. Females in this country, most of them become medical graduates so that they can become doctor brides, which means a woman who has a medical degree, has a very high social and noble standard in society, gets married off in the biggest families, but does not work as a doctor.
कित्थों चली ते कित्थे आ गई नी मैनू बात समझना आई.
Every year, thousands of women in Pakistan qualify as doctors. But a majority of them stop practicing medicine after getting married or having children. Dr. Sarah Saeed Khurram was one of them. 7 years ago, Sarah quit when her first daughter was born, and soon moved with her husband to a new city.
Only one of us, me or my husband, could work at that time, and he obviously had to work being the man. Within that time, as I was home, I was hit by postpartum depression because all my life I had worked for the medical degree. I had no other ambition, no other dream but to become a doctor.
It was then that Sarah envisioned an idea to help herself and other non-practicing female doctors like her. She teamed up with her friend, Dr. Ifat Zafar Aga, to launch Sehat Kahani, a telemedicine startup to empower female doctors.
Sehat Kahani is a network of female doctors that connects patients to online, home-based female doctors to provide quality and affordable healthcare. 50% of our population of 200 million people never get to see a doctor in our lifetime. So we started making clinics in low-income communities where we upgraded existing traditional clinics into telemedicine clinics. We trained the nurses, we provided them with the software so that when a patient comes to a clinic, the nurse's clinic, they can be connected to an online doctor from anywhere in the world.
Initially, there were a lot of challenges. Communities obviously were apprehensive. Women had this concern that, oh my God, are they taking my pictures? Will they make a video of mine or what? We would go out, create a gathering of women, sit with them on the floor, kind of do a demonstration with them. So it was all about building that trust from that very base level.
Hello, अस्सलाम वालेकुम डॉक्टर।
वालेकुम सलाम, कैसे हैं आप?
ये कान में दर्द, ये गले में दर्द और ये आधे सर में हो रहा है।
आपको कमजोरी के लिए भी दवा दी है, उससे भी नसें जो है वो खिंचती हैं, ठीक है? उसकी दवा भी दी है और सर दर्द की भी दी है। आप खा के फिर 3 दिन बाद आप आके मुझे दिखाएंगे दोबारा, ठीक है?
1 year after making clinics, we realized that healthcare is not just a problem for the low income, it's also a problem for the masses. So we also launched a mobile version of our platform that allows people to access doctors independently through a smartphone app.
That's when COVID-19 struck. The app was launched in late 2019, but before it could take root, the government announced a nationwide lockdown from April to May 2020. And the telemedicine clinics across the country had to remain closed. The newly launched app managed only a few downloads.
So we were standing at around 28 clinics at that time, and all of those clinics had to be shut down. We didn't know when would these clinics reopen, for how long can we actually sustain these people. We were in the middle of raising our pre-Series A investment round. Even that wasn't complete yet.
It was a brutal blow that hurt the company's only source of revenue. COVID-19 has severely hampered the operations of many businesses, pushing the nation's economy into a tailspin. In early 2019, in the face of a monetary crisis, Pakistan was granted a $6 billion bailout by the IMF. The pandemic has only deepened the nation's economic crisis and has exposed huge gaps in the already overstretched public health system. The nation has so far reported nearly 565,000 cases and claimed over 12,000 lives.
Pakistan has 200,000 doctors in totality. 60% or more are female doctors, but only 1 out of these 4 doctors practice. Rest all become doctor brides. So we are missing around 80 to 90,000 female doctors from the ecosystem who are not practicing. Couple that with 25,000 doctors who leave the country for better work opportunities, you have only 90,000 doctors for 200 million people. That means you have 1 doctor for 1,700 people, which is way below the WHO minimum standard of quality of care.
With unflinching resolve to assist the nation in battling COVID-19, Sarah and Ifat found a way to pivot Sehat Kahani. They shifted the company's entire operations from the clinics to the mobile application and offered COVID-19 telemedicine services free of charge. They have since conducted nearly 200,000 online consultations, impacting over 1 million people. The app's Tele-ICU system, rolled out in over 60 intensive care units in partnership with the government, connects ICU doctors with critical care specialists anywhere in the world.
What we have to do right now is कि wait for the chest X-ray. आपने treatment बहुत अच्छा initiate कर दिया है, Azomax आप दे चुके हैं, but do you think कि we need to escalate the antibiotic?
Diabetes और blood pressure उनका वो controlled है.
I feel like a superhero. It's a great feeling. Like, I did not know when I started doing ICU that I could reach out to so many people in need.
डोज में ना क्योंकि इससे आपका बीपी कवर नहीं हो रहा तो अब आपने 2 टाइम लेनी है ठीक है
31-year-old young mother, Dr. Mavesh Khalid, who got married 8 years ago, had to give up being a doctor to take care of her family. The app has given her the confidence to resume her medical practice. She's now able to engage with patients across the country from within the confines of her home.
ठीक है आपको एक ताकत की गोली भी लिख के देते हैं आपने वो भी रोजाना लेनी है पानी के साथ ठीक है फिर एक हफ्ते बाद Dr. Sara and her initiative I say these are the queens who empower women so in a city like Karachi I mean जहाँ पे इतनी सारी female doctors हैं sometimes you know we cannot continue practice उनके लिए this is a great platform perfect actually fit for them
उनको तकरीबन एक हफ्ते से है
एक तरफ का ये दोनों साइड पे होता है ये एक बहुत बड़ा एक इनिशिएटिव है कि ज़्यादा से ज़्यादा लोग ज्वाइन करें मोर फीमेल डॉक्टर्स बीइंग पार्ट ऑफ इट सो दैट वी एक्सपैंड द होल सर्कल एंड इसको हम ग्लोबली लेके जाएं आगे हैप्पी बर्थडे टू यू हैप्पी बर्थडे टू यू हैप्पी बर्थडे डियर सारा
In the next 10 years we want to scale this big time. We want to be that female-led telemedicine company that comes out of Pakistan. We want to be able to impact at least 25 million lives in the next 5 to 10 years through scaling up our network of clinics as well as making our application available globally.
When the pandemic struck, Pakistan's economy was already weak and it has now suffered massively due to a fall in global demand. To mitigate the effects of COVID-19, the Pakistan government announced a relief package of $5.6 billion for low-income groups, deferrals of loan interest payments for exporters, and an additional $63 million to support small industries and the agri-sector.
The biggest lesson we have learned is that all businesses and the industries must keep a lot of finance to face such situations. And the second thing is that the lack of healthcare facilities in developing countries, especially countries like Pakistan or maybe India, we need to spend a lot of money on such projects.
For Pakistan, the pandemic's economic impact will be felt well into 2021, but pivots initiated by a few businesses like Sehat Kahani are ensuring growth in the face of a crisis.
If it's good, people will come back, they will pay us, we will last. If it's not, we will not last. So I think it's only because we took a risk in taking this decision of providing our app to patients, to corporations, to launch a tele-ICU project that has maybe pushed us ahead of the curve. If this had not happened, maybe it would have taken us 3 or 4 years to convince people of the same story that we were able to do in 6 months. But yes, I think having a pandemic with a healthcare focus where everything went digital, we took use of that opportunity and we made it work to the best that we could in that time.
It's been a tough 2020 for everyone. Tougher for one island nation in the subcontinent. Though Sri Lanka won high praise for its swift action and strict protocols to contain the virus and has reported a little over 82,000 cases, the pandemic has put additional strain on the nation's economy.
The lowest point in terms of business activity is market accessibility. Big issue countries faced with is issues in relation to supply chain. Every product and service we produce in Sri Lanka depends on foreign inputs. So in terms of sourcing foreign inputs, we've had humongous issues.
The pandemic has cut deeply into Sri Lanka's lucrative travel industry and outflow of foreign investment. The economy has been gravely hit owing to the decline in demand and disruption in supply chain in export-oriented industries. The government swiftly initiated a social protection response to reach a majority of the population with cash transfers and with concessions to industries.
Not everyone got the concessions, and they had to find other forms of revenue in order to stay afloat. Every single sector crashed, went down. It's all about survival, and some people have done it better than the others.
Fine Finish Engineering, headed by Chicago-based Gamini Hewawasam, is one of Sri Lanka's leading provider of manufacturing and industrial solutions. In January 2020, Gamini invested in brand new machinery with big plans to expand the business. But COVID put a damper on this. Following the nation's lockdown and ban on public transport, many of his workers were stuck inside the factory.
It was, I think, 38 people were inside the fine finish facility. So then, I don't know how the guys did, but they survived almost like 20 days. So that was a very tough time. We never knew what's going to happen tomorrow. I don't think that I can even list it down. It was the amount of challenges were unbelievable. But only thing what we knew is we needed to work together to survive together.
Gamini was faced with the daunting challenge of retaining over 100 employees and paying their salaries. But he did not want to let them go. Instead of surrendering to uncertainty, he decided to create an opportunity for survival.
When we do a business, yes, we have a main goal of making profit. But with this COVID situation, making profit was not the priority. The priority was how I am going to survive, how I'm going to let other people to survive.
Innovation became part of Gamini's survival strategy. He pivoted to an entirely new industry and founded Goviyu, Sinhalese for farmer, to promote vertical farming and to keep his team members who would have otherwise lost their jobs. Gamini encouraged his team to grow food and utilize the fine finish factory to produce greenhouses, thus transforming engineers into farmers.
COVID, it gives an opportunity for us to go back for the basic. And there is no way for us to go and get the food, even though we have money. Can we go back to the backyard? Can we go back to our rice field? We have done more than 100 Zoom meetings and educating each member, and then say, well, let's find a way to survive.
With the nation opening up slowly, Fine Finish Engineering has started producing at 90% of its capacity. And with Goviyu clinching some 13 orders for greenhouses, Gamini is now hiring a team to take the new business to greater heights.
Finishing එක හොඳටම ගන්න ඕන නිසා ඒක ඒ අදාළ ඒ දීලා තියෙන
Definitely there is a future for Govio beyond COVID. The future for Govio, actually, we are not focusing only on the local market, and we are focusing the international market. The future of Govio is limitless.
So currently, local manufacturing ratio has significantly gone up. If the country can maintain it, it will be well and good. Certainly pave the way for economic recovery. Globally, the markets have to recover also. Sri Lanka's progress would heavily depend upon how fast globally we can recover from the COVID impact.
Sri Lanka's growth prospects are dependent on how fast its neighbour and largest trading partner, India, recovers. India was quick to impose strict nationwide lockdowns that lasted for over 2 months, coming at great human costs and slowing down the economy.
It was, to be fair, already slowing down quite dramatically. In 2019-20, we saw a GDP growth rate, decelerating down to about 4.3%. And then the pandemic hit, and consequently, we're going to be exiting this year at about -7.5, -8. And so it's been a pretty terrible year, and not just from a GDP perspective, but I think two other factors which have really hit India is the massive rise in unemployment and the sharp increase in income inequalities, both of which are bad news.
The biggest challenge in the COVID times has been that the companies were not sure of their incoming cash flows because they are not able to make sales, and because of that they still had to incur expenditures in terms of rents and salaries and other costs. So the biggest challenge for them has been how to manage their cash effectively so that they are able to survive the pandemic.
India's lockdowns in March 2020 delivered a gut punch to New Delhi-based chefs Radhika and Ravish.
वो हम प्लास्टिक शीट्स लगा देंगे ना उसके सामने हाँ कर्टन लगा देंगे
3 years ago, they founded Fig and Maple, a fine dining restaurant that uses sustainably sourced local produce and strives for zero waste. The pandemic derailed their plans to expand the business and open another restaurant.
Initially, the first 2 weeks is the only time the restaurant was actually closed. After 2 weeks, Ravish and I managed to sneak our way into the restaurant because we happened to live just 2 lanes away. It was just surreal. We came back to a space which was like covered in dust. The food was rotting. It was a mess.
The lowest point has to have been like coming and opening up an empty restaurant and just sitting around and waiting for orders to come in. Sometimes you'd be at the restaurant for about like 16 hours and you'll have like 1 order in a day.
It was just something which I was absolutely not used to because I'm used to a really popular, busy restaurant, and it was just a really, really despairing situation.
We have staff that we need to pay, like we were not going to let go of anybody. For the first 2-3 months, we paid them their entire salary. Then we brought it down to like a 30% cut and then a 50% cut so that even they're able to support their families because they've been with us in the good times. So it wasn't fair that we let go of them during the bad.
Faced with the question of adapt or perish, they started taking orders and delivering to customers. But the delivery model was not a success overnight.
We always took pride to be an experienced restaurant. You know, we were a chef-driven space, fresh produce. We focused a lot on the presentation of the product and you know, all the cocktails coming with it, and just generally a good time is what we would expect when we had you over at Fig and Maple. However, how could we replicate that experience in a home which we were not familiar with? Like, every consumer's house is going to be different, and how do we pivot to a point where we can bring the restaurant experience home?
It was a do or die situation that compelled Radhika and Ravish to reimagine their business model to survive in the short term and thrive in the long term. They pivoted a few times, from a delivery model to DIY cocktails to signature sauces.
The way we pivoted was according to what the consumer demanded at that point of time. Idea of deliveries, I think, immediately and instantly failed for the first 1 month, and then suddenly it was good again. However, these pivots also struck because we saw that there was a gap to kind of, you know, create products at that point of time to suit that sort of market.
With the launch of their website and signature sauces, Radhika and Ravish are starting to see the business picking up again. The duo has constantly been honing ideas to make them stick. Quitting was never an option.
We had nothing to lose. There was like, what could we have lost more than this? Spatula. We launched dumplings, we launched sous meats, and that was, I think, the biggest pivot for us at that point of time. And it still contributes to about 15 to 20% of our sales, even post the lockdown opening.
The restaurants, you know, the whole industry really suffered. I've read that about 1/3 of all restaurants have shut down forever, which is a great tragedy, obviously. But at the same time, those who were able to pivot and those who were able to do home deliveries and adopt digital means of ordering and so on, they've managed to come through and are now thriving again. Yeah.
After the pandemic, what I've learned is not to take anything for granted, and we take it as each day comes. We still try and pivot as much as we can and create new things.
I think mine succeeded because need is the mother of invention, and I had no option. We are back to about 80% of our sales. In fact, January 2021 and January 2020, we've made the exact amount of money so far. I have a good feeling about 2021. Hopefully, the entire industry will bounce back real soon.
The pandemic has allowed businesses like Fig and Maple to expand, add verticals and new revenue streams. It has opened up new horizons for those nimble and willing to adapt.
COVID is a crisis point. So I think what we are on is setting a pattern for futuristic rural living lifestyles that will make India the organic food bowl of the world.
The pandemic created various operational and financial challenges for Indian businesses. Major companies suspended operations. During the lockdown, a little over 71% of the businesses dealt with reduced cash flows, with the manufacturing sector being the worst hit. The government announced various measures such as economic relief measures for the poor, as well as sector-related incentives and tax deadline extensions.
I think every CEO and every entrepreneur will look into 2021 and beyond with the lens of trying to figure out how to create what I would call shock absorbers in their business. These shock absorbers will come in the form of having sufficient cash in the bank, having the technology platforms, whether you buy them or you build them, to enable the business to be nimble, stay nimble, pivot, and be agile, to have a very clear and well-articulated go-to-market strategy so that they occupy their niches in the market.
The lockdowns took a heavy toll on India's tea industry as they coincided with the first flush harvests of both Darjeeling and Assam, causing ripples throughout the tea drinking world.
COVID is a crisis point. This COVID has opened the eyes to a paradigm mind shift.
He is a legendary tea maker and the fourth generation owner of a tea estate spread over 1,600 acres on the steep slopes of India's eastern Himalayas. Raja Banerjee, a name synonymous with Darjeeling tea, pioneered organic cultivation of tea in India, the world's second largest tea producer.
I was born into a family, the oldest family over here. My great-grandfather created the first tea factory in the world. We have a tea heritage. We pioneered organics because healthy soil is healthy mankind. When you farm sustainably, you are in partnership below the land, above the land, in cyberspace, and down in a holistic green circle.
2 years ago, at the age of 70, he hung up his planter's boots and exited his family estate of 150 years to make a new beginning, but not before granting his 12% stake in the estate to plantation workers.
Post exiting my ancestral gardens, I took a year's sabbatical. After a year of this sabbatical, in middle of July 2018, I had a dream. And the dream was, it kept on repeating Rinpoche, Rinpoche.
What appeared in a dream crystallized into a new business, Rinpoche, meaning reincarnated avatar. As a fair trade practitioner, Raja Banerjee sought to develop a holistically sustainable agricultural economy for the marginalized small growers in the northeastern states of India. And this was right around the time the pandemic struck.
This 1.5 toughest period of existence, because COVID traumatized everybody. All the tea estates were shut, people were terrified. The hit that Darjeeling tea industry has taken this year. A, losing the first flush, that is the most profitable, lucrative crop. It's gone, complete loss. That's about 15% of your net revenue. Then you lost the second flush. You've lost 60%, another 35%. That's you're looking 45% revenue gone. And in terms of numbers, crop loss, you've lost another 15% because it's overgrown. They'd have to be completely thrown away. So you've lost 60% of revenue. And you have lost, the crop has come down from 9 million kilos to 4.5 million kilos, only harvest last year. Okay? And people were confused. And when you're confused, you lose track of what you're doing.
That's when the legendary tea maker changed tack. He steered the company into a partnership model through which he seeks to bring together around 74,000 small growers from all over the country. Between May and September 2020, he aggregated teas from 4 villages in Darjeeling, marketed them under the brand name of Rinpoche, and launched an online tea store. Additionally, partnering with other e-commerce platforms to sell teas. But it doesn't stop there for Raja Banerjee.
We are only going for the top end with the tea, but we shall also branch out into other means of lentils, spices, tisanes, rice. This is the post-COVID initiative. We are taking a lot of communities in a dynamic sense. And we are not rushing it. We are taking it very slow and easy because we want to lay a foundational stone post-COVID of sustainable reality. It will make India the organic food bowl of the world.
What started off as a glimmer of an idea to kickstart a small growers movement has today metamorphosed into a grand design to produce food sustainably.
The first 3 months of COVID was extremely challenging because nobody was buying anything. Then it opened a different dimension and we found a different world.
The nation's lockdowns may have hit many businesses in India hard, but with the economy picking up, the recovery could gather pace too.
From what we see and what one reads, renowned economists, the IMF and so on, are all now pretty clear that it's a V-shaped recovery for India, and the economy is bouncing back with an 11% plus growth rate in the next fiscal. That is fantastic news. I do hope that it comes back with a reduction in unemployment rates. While everyone is hypnotized by the GDP growth rates and the forecast of 11.5%, I think we'll do ourselves a lot of good if we have an equal amount of passion and an equal lens on employment rates.
The economies of the countries in the subcontinent are expected to gather pace amid signs of a pickup in consumer demand, government spending, and a resumption of most economic activities. But much depends on how successful is the vaccination drive in these countries.
India's economy, or indeed those of any of the South Asian countries, are going to take a very, very different sort of route depending on how well the vaccination process works. So one scenario could be vaccination is largely successful and things go back to being what they were before in a sense. Another one could be a partial success rate for the vaccinations, which will see a greater degree of volatility, greater degree of risk for all businesses. And then there's the doomsday scenario where the vaccinations actually don't work and the virus makes a big comeback. Now, if the virus makes a strong comeback, then that's going to demand a very different response from CEOs and entrepreneurs relative to if the vaccinations actually work.
The South Asian region is expected to grow by 3.3% in 2021, substantially weaker growth than during the decade leading up to the pandemic. Many businesses have been devastated, but the recovery process has also already begun, with those agile offering hope by embracing innovation and preparing to thrive in a post-COVID world.
The biggest argument that Sehat Kahani got from patients was that without touch and feel, how can you see a doctor? That element got completely wiped out in COVID-19, because in COVID-19 you did not want to touch a doctor. You wanted a doctor who's away from you. So I think that helped our narrative much more. So when we had our solution, when we had our clinics, when we went with our mobile app, people readily took it, because that provided them an instant connection with doctors without touching or feeling one.
We have transformed the entire region of Darjeeling by going sustainable. What's in it for me? To leave a better footprint for others to follow, the sustainable reality. Because what I'd like to see is a blooming world where everybody's living in peace and harmony. Because all issues of humanity is about harmony. And sustainable practices, if you can initiate it, will leave my children, my grandchildren, and my great-grandchildren for a better world.